Dr. Andrew Larson is a board-certified general surgeon, and he is going to be talking to us about a few things. One thing that was very important, and we had Dr. Jose Arascu on because we are talking about the Palm Beach Medical Society, the forum that is going to be occurring October the 9th and the 10th over at the Kravis Center. But I'd like to get into some specific medical discussions with Dr. Larson. So I see where you do bariatric surgery, and of course we're going to be talking about people being obese, not just overweight. And I thought that would be an interesting topic for people. When do you as a physician make the determination that there should be bariatric surgery?
Well, in my practice, as in most complete practices, the patients that come in are evaluated by our specialist nursing staff. They're evaluated by our nutritionist. They're evaluated by a psychologist. And then, of course, I evaluate them myself as the surgeon. And what we're looking for is typically persons who have 80 to 100 pounds or more to lose and who have not been successful with dietary or lifestyle modification to this point in time. Many of these people, this is pretty much their last chance to regain their health.
And what I have noticed with people who have had the surgery, it does leave, if it's really 200 pounds, or, a major reduction, they are left with a lot of drape, a lot of, I guess they're just skin that drapes. Do they then go and have to have surgery by plastic surgery to do something with that, or what happens to that skin?
Well, it really depends from person to person. I mean, with good nutrition and exercise afterwards and making sure that they're taking the vitamins that they're supposed to and the weight loss is not too rapid, many people can avoid, getting too much excess skin in the first place. But sometimes it is unavoidable. I mean, if there's a lot of weight to be lost and, the genetics plays a role too, and then, yes, then we'll make a referral to one of our area plastic surgeons and discuss their options as far as contouring the skin.
Mm-hmm. And so I'd like to just kind of fool around with that, with the obese person. You said that when someone comes in, you have I'd call it a consortium of medical practitioners, psychologists, and people who just absolutely, can help. But there are people who say that it's not, I don't eat much and this, I just keep gaining weight. Is that really true?
Well, we do measure everybody that comes in, their metabolic rate. And so, I actually, when we first started doing this, was rather surprised at the great diversity of metabolic rates that we've measured, from 1,000 calories a day on up to 3,000, 4,000, 5,000. And I think that there legitimately are people who are not eating that much by perhaps my standards, but are still having a very hard time, maintaining a healthy weight.
Yeah, so, you wonder, and then you see, of course, some people who can eat everything and they never add any weight. And so that's a different, I guess that's another whole different thing. and
those folks are lucky.
Right. Well, let me also applaud you for all the work that you do, and you're very busy, and yet you've had time to write 4 best-selling books. Tell me about your books.
Well, sure. My wife and I write these books together. I mean, all of them are healthy nutrition books. They are anti-inflammatory diets that can fight chronic disease and sometimes prevent chronic disease, including things like diabetes, hypertension, autoimmune conditions such as MS, which is actually a condition that my wife struggles with. And so we've written these 4 books together. The most recent one and the most successful one is called Clean Cuisine. And she handles all of the recipe development and designs the workouts that are included in the book. And I provide some of the medical advice and some of the research that helps make the book as scientific as possible. We also have a website that is called cleancuisine.com, all one word.
Okay,
and,
CleanCuisine.com?
Cleancuisine.com, that's correct. And a lot of the recipes that are in the book are also on the website. There's about 200 recipes, and there's at least 300 or 400 articles, including workouts and information about one recent post was, are microwaves safe, for example, and just a lot of good health information for people that are looking to live as well as possible through better nutrition.
Well, I admire you for being a surgeon in that area, and also these books coming out. And I'll tell you what, if you get me a review copy, have you seen Boomer Times?
Yes.
Well, I would be glad to do a book review for you on that book.
Oh no, that'd be wonderful.
That would be wonderful for us also. I love the name. Was that your wife's idea?
If it's a good idea, it's probably.
Oh, you bet. She has you trained. That's great. Okay, well, I love that. Let's move back a little bit. I think we've done a lot on the weight, and we'll do your book. But I want to talk about laparoscopic surgery. Discuss that with us, please.
Sure. Nowadays you're probably, as part of the public, hearing all kinds of stuff about minimally invasive surgery, robotic surgery,
right,
laparoscopic surgery, and the hospitals are all pushing some of these techniques. But what laparoscopic surgery is being able to do abdominal surgery without making a long incision in the wall of the abdomen. Instead, we use incisions that are less than half an inch long and specialized tools to do operations that in the past required a long incision and a long recovery. And, I think that with better and better technology, we're able to do more and more operations laparoscopically.
Now, are you doing this using a computer or ultrasound, or how are you seeing what you're doing?
Well, the equipment includes a very high-tech camera that is hooked up to 2 or sometimes even 3 monitors in the operating room. So everybody in the room, including the nursing staff and the anesthesia team, can see exactly what's going on. And that's great because, every once in a while the surgeon might miss something. So everybody can see what's happening and everybody can, bring their information to the table. There are techniques. I know you mentioned computer. There are some surgeries that are done with the surgical robots that you're hearing so much about.
Yes.
In that case, the surgeon is sitting at the robotic console and actually gets a 3-dimensional view of the interior of the abdomen. And the robotic equipment can help if you're doing very delicate surgery. I think a prostate resection is one example where it can be difficult for even a very good laparoscopic surgeon to do it perfectly, whereas the robot allows you that additional dexterity to throw the sutures exactly how you want them thrown.
So you've had a lot of extra training, sounds like. I mean, you have a great resume, but now you had to go for a lot of postgraduate work, I assume.
Well, yeah, it's pretty much a constant educational process. I mean, the technology changes. I just was at a conference back in June dealing with medical weight loss, some new medications that are available for people who don't have so much weight to lose that they should be considering surgery.
That's great. Yes, it just keeps going on and on and on, and we just do applaud all of you doctors who've been working so hard in this field. And I know you've had a lot of things thrown at you, but when it comes down to it, that patient really lives or dies, and I don't mean that really lives or dies by you, but in their mind, they really do respect you. They need to have someone that really cares about them, and it sounds like you certainly have become really very skilled in some of these areas. So when you were going to medical school, when did you decide that you wanted to cut into people? I'm sorry.
Well, actually, as I was still in medical school, I really was considering a career in orthopedic surgery because I was a mechanical engineer as an undergraduate major.
That's interesting.
It would make use of some of my undergraduate training, but as I got more and more interested in nutrition, largely because of my wife and how she was dealing with changing her diet because of her MS, I just became more and more interested in the bariatric surgery, the weight loss surgery, and I felt that it was just a way that I could have patients who I could counsel and coach over the years and really get a different type of relationship with them than I could if I was an orthopedic surgeon who simply fixed one fracture and might not see the person again.
That's very well said, and I just want everyone to know that You are the medical director for JFK's Medical Center's Bariatric Wellness and Surgical Institute. So if someone wanted to go to you, do they need to have a referral?
That would really depend on their insurance. They can simply call us up at 548-2274 and set an appointment. We also every month offer free information sessions, which is at the bariatric center. And a lot of people who are still, not 100% sure like to come to those and just get a chance to meet the nurses and the surgeons and hear about the different options without having to commit to a copay or to an office visit.
And you have support groups, I'm sure, after someone's had the surgery.
Absolutely.
Yeah, it's now, I guess for you, it's very painful when you've done this, it's been successful, and then people start eating again. They're not supposed to, right? You're supposed to have shrunk their stomach, but somehow they get to go back, huh?
Well, yeah, I think people have to be realistic. A little bit of weight regain is almost considered normal, as a matter of fact. But when there's a significant amount of weight regain, it can be frustrating. But if you go to a place where there's good, experienced surgeons, they can order the necessary tests to see if maybe it's not just you're eating too much, but maybe there's a problem with the first surgery. And I'd say about half the time we're able to help people mechanically, and they do get a lot of the weight that they've gained back off again. Obviously, in some cases, more intensive psychological or nutritional advice is necessary, and if that's the case, we make the diagnosis and we start that process.
I'm glad to hear. So this is not just this happens in plastic surgery a lot. Someone comes in and they want to look like this, then they go back and they go back and they go back, and I think they have a psychological problem to begin with. And I'm hoping the same thing now with bariatric, and I hear you talking about it, is that you're able to foresee the kind of patients you have, and you know what you're dealing with.
Well, we try to help as many people as we can, and very, very few are turned away for psychological reasons because we have the experts here to help people with those issues.
Yeah, and that's extremely important. My guest is Dr. K. Andrew Larson. What does K stand for?
Kenneth.
Okay.
My father's name was Kenneth.
Oh, okay.
So we didn't want to get confused.
Okay, so Dr. K. Andrew Larson, he's a board-certified general surgeon specializing in general surgery, advanced laparoscopic surgery, and bariatric surgery. He has great credentials. He studied at a lot of the finest universities, and he's here now. Oh, actually, I see you are a voluntary assistant professor at the University of Miami. So are you down there trying to help other medical students get on?
Oh, no. Actually, I as part of the I teach residents how to I train them to do surgery, and the residents that we have at JFK Medical Center, although they're based here in Palm Beach County, the program is overseen by the University of Miami, so I have a faculty appointment.
I see. Well, that's right. They always have to have someone, and I'm going to ask you a strange question because I have just giving my body to science care, so that I feel it's very important. Did you fall in love with your cadaver?
Oh.
Because I'm going to be someone's cadaver, I hope, and I'm serious about it. I think that I have talked to some other doctors, and they said, oh, yeah, that semester was very important.
I think that it being the very first course that you take in medical school, I think it really does, throw you right in there and really, give you an appreciation for the human body. And I think that I hope that experience doesn't go away in the age of simulation and robots and computers.
Ah, that's true. I heard someone, one of the other doctors just talked about, that's right, you can see everything virtually. You get on there and you see everything, but he says nothing like a real body.
I think it's at some point in time you just have to, get exposed to the real surgery and, with supervision, of course, but I don't know that a simulator will ever replace the actual.
Right, of course not. Well, that's really good. And, of course, and then you, as a person that's into bariatric surgery, that's another whole story. How do you, get to what you have to get to with all that fat, and then what do you do with the fat? I was curious about that. I don't know if we have time to go into it, but what do you do with all that extra fat that you have to take away?
Well, during the surgery, we're not actually removing any of the fat. I mean, we're counting on the decreased calorie intake afterwards to remove the fat itself. It certainly makes any surgery a little bit more difficult when you're dealing with a significantly overweight person. But that's why we counsel people to go to very experienced surgeons who've dealt with this hundreds, if not thousands, of times before and are ready for the challenge.
Yeah, and there are so many different ways that I know, and I don't remember the names of them, but various ways that you do close off the stomach, or I don't know exactly how you call that. When they sometimes they say, well, you can only have a half a cup now of food because there's no more room.
Well, yes, there's actually 3 different types of surgeries that we offer, and the technical details are just too much to get into right now.
Sure.
But all of them work by making the stomach hold much less food before you start to feel full. You feel very full despite eating a lot less food.
Right. Would that be a good subject to have you on the show another time to talk about the various?
No, I'd be happy to.
Sounds like it's a big decision then, and one is maybe not right for everybody, and I'm sure you can advise them.
We can advise, and I've found over the years that most of our bariatric patients have actually done quite a bit of research themselves. I mean, This isn't a decision that they take lightly.
Thank you, Google, right? Yeah, no, of course it's not lightly, but they depend on you too. They know that you're experienced, and you probably know the differences well enough, and you've had enough experience that they're going to lean on. I'm sure they say, well, what do you think I should do, doctor, right?
I do get that question.
Yeah, I'm sure you get. That's like a lot of doctors, a lot of people say, well, if this were your mother, what would you do? Right? Comes with the territory, doesn't it? Well, it's been great talking with you, Dr. Larson. I look forward to seeing you there at the forum, and I'm glad that you're participating. And I know that people are listening to the show, and if they want to get in touch with you, they're going to call 561-548-BARI, and that's at the JFK Medical Center. And this is a very serious subject. Of course, we've been making light. I have, as a matter of fact, because I know it's very serious. And if you want to really talk to an expert, and you don't have to be ashamed, and you can go and see what's in the cards there for you, and maybe this could change your life. I was just thinking about people who now are alone, and they're older, and they really want to have friends, and some people, when they're so overweight, they won't go out of their house, and I know you know all that, because they're embarrassed, because they can't get around, and maybe this could change their life.
It can, and I think that it's important to know that some people think that the surgeries are not covered by insurance, but here in Florida, both Medicaid and Medicare cover the surgeries, and so they are available to more people than you might think.
Because it's really a medical procedure. I mean, that's what makes the difference. And I'm sure a lot of people come to you with diabetes and so many other things that the weight has caused. And so I do wish your wife a lot of luck with her MS. I know that you're on the cutting edge of that, I'm sure, and anything that's possible will have. As a matter of fact, I know people who have had MS for a long time, and they're still there working hard at it, and they're doing fine. So I hope that's the case for your wife. And
it has been. I think a healthy diet's been a big part of that, too.
Right. And the cleancuisine.com, look it up, and hopefully you're going to see it in Boomer Times. We'll do a review of it, and thank you so much, Dr. Larson.
Okay, well, thank you very much, Anita.
All right, bye.